Hi, class. This is my icebreaker introduction for virtual clinical. So my clinical sites for this term will be at ReadyMed, which is an urgent care run by Reliant Medical Group, and 260 hours will be with a physician assistant by the name of Jared Aldrich. His background in emergency medicine, and I had the pleasure to be able to work with him in the emergency department, and now he's taking me on as a student. This location will give me ample opportunity to get my hands on some procedures like doing stitches and INDs, and being able to see a wide range of patient ages and complaints. I will be doing 40 hours in primary pediatric care with Dr. Kathleen Reardon. She was actually a nurse before she went to medical school, and continued on to become a pediatrician, and has spent her entire education and career here in Worcester, Massachusetts, which is where I live. I actually met her while doing COVID vaccine clinics when we were trying to vaccinate the public. And she's an amazing lady, and I can't wait to see what I can learn from working with her in pediatrics. Concerns and highlights for the term. Certainly my concern is having enough time. Trying to manage 300 clinical hours seems like a lot. And it helps me when I break it down to how many hours each week do I need to complete. And that's about 17 hours. Not that I did the math. And I work full time as an emergency room nurse, and have been in the emergency room setting for about the last 7 years. So, certainly diagnosing patients and really, starting at the beginning is something that I'm very much familiar with. So hopefully that will help. That kind of puts me over to the opposite side of things, which is the highlights and never giving up. I started my educational journey with a GED. I unfortunately did not have the opportunity to graduate from high school, but instead had to leave high school when I was 16 to take care of my siblings and raise my brothers. So never did I imagine that when I started this almost 20 years ago in going to college, that I would be looking at a master's degree and a nurse practitioner certification. So I'm incredibly proud of myself, and I have to be mindful that I am my worst critic, and I hold myself to very high expectations. So I hope that we can all give ourselves a little bit of grace. And the force that keeps me going are these two amazing human beings right here. This is my wife, Christy, and our son, Cameron, and he is 2.5, going on 40 is what we say. And he keeps us really busy, but she does an amazing job at balancing life and raising our son and making sure that I don't run out of clean scrubs as I get through week to week. So hopefully that gives you a little bit of insight into who I am, and I look forward to meeting all of you as we work together in our virtual clinical.